Dr. Mauro, please.
Thank you very much. It's again a pleasure to be here and an honor for me to be part of the meeting, and thank you, the organizer, to give me this privilege. I will speak about in this session of contrast reduction policies, if it's possible to decrease the amount of contrast medium in the treatment of a fever. We know, according to the literature and our experience, that we have a renal function worsening in the perioperative period after fever in about between 10% and 20% according to the aortic disease. And the causes of renal function worsening are the preoperative renal dysfunction, the intraoperative renal lesion, and contrast medium. If you look to the contrast medium, the question is if it's possible to do a fever with a reduction of contrast media. It is possible to do this probably according with the new technology. First, the use of vessel navigator in the theater, the majority of cases in the hybrid room, we have the possibility to use vessel navigation to engage the vessel according even with the procedure that Stefan presented us some minutes ago. And the other point is the use of new contrast medium. And we have today the possibility to use CO2 angiography, and we defined the role of CO2 in this paper in the EVAR treatment. And our conclusion were that this CO2 contrast medium is safe, it's excellent for the visualization of hypogastric artery in the type 2 endoleak, but we have some problems regarding the detection of the renal artery anatomy. The role of the problem is regarding renal artery, the distribution of the CO2 inside of the aorta. If you look to the clock position, you can see that if you use contrast medium, iodinate contrast medium, this is the distribution. But if you use CO2 is a gas, then it's possible to see only the anterior wall of the artery and of the aorta. And if the visual vessels, the ostium is in the posterior wall, you have some problem to detect exactly the patency of this artery. Like this case, you can see that it's possible to have on the right side, on the left side, the renal artery with iodinate contrast medium, but if you have ostium of the left renal in the posterior on posterolateral wall of the aorta, you don't see the renal artery. It is possible because the CO2 floats in the anterior aortic wall. You can see without any problem the celiac trunk and the SMA. Then it is possible, the hypothesis is that it is possible to reduce the contrast medium during a fever according with the use of vessel navigator and CO2 automated angiography. And according with this hypothesis, we did a study that we presented in the last meeting of the SVAs in Washington to compare the result of 3 and 4 fenestrated performed by CO2 angiography associated with vessel navigator. And we compare this result with the iodinate contrast angiography with vessel navigator. We defined 2 groups, one prospective collected and the second one retrospective collected in juxtarenal and pararenal abdominal aortic aneurysm and type 4 thoracoabdominal aortic aneurysm treated with 3 or 4 fenestrated endograft. These are the protocol endpoints, the procedure and the follow-up endpoints, procedural technical success, iodinate contrast medium, fluoroscopy time, radiation dose, endoleak detection, and follow-up renal function worsening perioperative period, reintervention after 30 days in 6 months. We collected 45 patients, 33% treated with CO2 angiography and 67% with iodinate contrast angiography, without any difference between the 2 groups regarding demographics. If you look to the age preoperative creatinine, GFR, and aneurysm diameter, no difference between the 2 groups, and the same regarding the distribution of the aortic disease. We used in 13% of cases 3 fenestration, 87% of cases 4 fenestration. If you look to the result, you can see that the difference between the 2 groups regarding the amount of iodinate contrast without any difference regarding time of procedure, fluoroscopy time, and total DAP. and no differences regarding the technical success, endoleak type 1 and 3, endoleak type 2 between the two groups. If you look to the visceral vessels visualization, we had no problem for the visualization with celiac trunk, SMA, before the introduction of the endograft, during the introduction and after deployment of the two renal stents. But we had an increase of percentage of visualization of renal arteries before introduction of the two stents between 63% and 83% at the end of the procedure. If you look to the clinical, perioperative clinical result, you can see no differences regarding death, spinal cord ischemia, cardiac and pulmonary morbidity. We saw renal function worsening in favor of CO2 angiography without any statistical significant difference between the two groups. But if you look to the creatinine increase of hospitalization, both these endpoints are in favor of CO2 angiography. If you look to the re-intervention, no differences between the two groups, CO2 angiography and iodinate contrast medium regarding the 30-day and 6 months re-intervention, no re-intervention in these two subgroups of patients. Then, ladies and gentlemen, in conclusion, this is a preliminary experience with CO2 automatic angiography and fusion imaging and preserving perioperative renal function in fenestrated endografting. We think that this approach is safe and effective. We have a good technical success, procedure time, irradiation dose. If you compare CO2 and iodinate contrast medium, in the group of CO2 we had the lower iodinate contrast with lower hospitalization, 30-day renal impairment without any difference in terms of re-intervention after 6 months. The problem is to define the renal artery visualization. We have to improve this visualization because at the end of the procedure we had about 80% of renal artery visualization and before the introduction of the endograft 65%, and then we have to work in this way, and in Europe we have now a registry regarding the possibility to use this CO2 in the visualization of renal vessels in patients for endovascular treatment of aortic disease. Thank you very much for your kind attention.